head, you will see the tongue. Any abnormality on the tongue, you may see some growth like pox or any cyanosis or swelling of the comb or the wattle. And you look at the eyes, if there is any discharge, coryza or even laryngotracheitis. You will see around the nostril any discharge. You squeeze the sinuses to see if anything is exuding from the tablet. So once you are done with the head, you look at the plumage, the nice and shiny plumage of this chicken, indicating a good nutritional situation. And you look for lice or fleas or mites. And then on the legs, you'd see any hemorrhage or any mites. Look for that. And around the bench, see if there is any diarrhea. You will see crusts of feces around the cloaca. It looks like this, but that's some diarrhea. And then generally on the nutritional status of the bird. For example, you hold here at the breast muscle over here. If the bone is protruding over here, the keel bone, then there isn't much muscle. So nutritionally this bird is not good. I mean, it's been deprived of the basic nutrient. So you'll do that and go back and you start looking into the oral cavity. You open the oral cavity. Next is you look at it if there is any lesions, lesions like pox, for example, or any abnormality. So with this, you conclude one more thing. You can see the heart joint, if there is any swelling. You remember some of the diseases which cause arthritis, like Mycoplasma synoviae or viral arthritis. The foot pads, if you see any swelling, like staphylococcus causing foot pad infection or joint infection, you would see what's called bumblefoot. You would see swelling here, and Mycoplasma synoviae also causes that as well. So basically we are done with this externally. Now we examine the bird internally. So what we do is, we have a tail brought somewhere here. So what we'll do is we'll dip the carcass in a soapy water so that the dandruff doesn't fly everywhere. It's good to manage that way. You hold the chicken by the head so that water doesn't go into the mouth. So dip it. once it is dipped, you just lie down by its side. This will cut. So you cut through the mouth, the oropharynx, all the way into the esophagus until the thoracic inlet. Yeah. And then you examine. So it looks like this bird had something. See here, casual necrotic debris. See, this is not normal. This is in the oropharynx, whereas in the oral cavity. So you may be lucky to see some lesions inside. So what are some of the lesions which cause this casual necrotic debris in the oropharynx we discussed? Newcastle disease is one of them. So that's keep in mind that. And this bird also had diarrhea. So it could be that, but we will investigate further. Then the next stage would be opening the larynx. Open the larynx. You see some mucoid exudates, probably some hemorrhage as well here. Is everybody looking? You see that? Okay. See the mucus here? It's the mucoid exudate. So then you articulate the hip joint. On both sides. Okay, so you lay the chicken flat on its back and then take your scalpel and cut the skin around here. That will allow you to pull back all the skin backwards like this. You can open the crop as well while you are here and see if you see any lesion. So there's a similar lesion like that one over here, if you see here. So you can appreciate the skeletal muscle here. If it's Marek's disease, you will see variation of the strips of the muscle because of myositis, the skeletal muscle, but that doesn't seem to be the case here. So we may be dealing with a different problem, like we suspected probably Newcastle disease or vitamin A deficiency because of this. But further, as we examine the organs, it will help us determine at least tentatively what the diagnosis will be. So the next step would be taking out the I think here. So gently, so that you don't damage the internal organs beneath. Okay. Now we have exposed the abdominal organs all the way to the thoracic inlet, and you can examine just visually the organs in situ. The liver looks okay. I don't see any pericarditis. That's all you can do at this stage. And gently lift up the liver. And grab the proventriculus at the anterior portion and cut it. And then gently pull it and separate it. You can appreciate the size of the spleen. It's not enlarged, it's normal size. And so grab your proventriculus. lay aside the GI tract so that you can examine it. We may have Newcastle disease here. Can somebody tell me what I saw or what you see? Where? Yeah, this is. You remember the slide I showed you? This is what it is. So this goes along with Newcastle disease. We may see further evidence that it may be Newcastle disease. So by putting the small intestine or the GI tract like this will allow you to observe the entire tract of the GI system. So we will take out the cloaca as well. So this part indicates it is dehydrated because these are the ureters. See that the ureters in here normally it seems like this, so it's not been drinking water for a while, or it was losing a lot of fluid as in the form of diarrhea. So while you are here, you can appreciate the size of the bursa of Fabricius. Do you see it here? That is the bursa of Fabricius. So the ureters, as you see, they both go into the cloaca. So the GI tract, as well as in the cloaca, is a common vessel for both the GI tract as well as from the urogenital system. So, do you guys see the bursa of Fabricius? I think it's important that you know this is a bursa of Fabricius here. It is in adult birds it is small, but in young, about 6 week old pullet, for example, it's about this size. So as the bird grows older, the bursa of Fabricius shrinks. It's an important organ, especially for the immune system. So that's why the bursal disease attacks the bursa of Fabricius, and the bird won't be immune for many. At least it cannot develop immunity for various diseases that can be easily vulnerable. Now we have removed the cloaca. Okay. This is a real case of Newcastle disease. Do you see the hemorrhage over here? So we have hemorrhage in the small intestine, like here. And maybe we will have more hemorrhage here in the cecal tonsil. Oh, enviarlo? Okay, very much. Okay. Silkacho wala? Okay. You want to see this? We can start from the proventriculus, actually. You should go down to the cloaca. Like the book says, we see everything what we saw on the slide yesterday. Okay. What did we say? Hemorrhage, ventricular gizzard junction. You see this? What is it? This is the hemorrhage we talked about on the slide yesterday, at the proventricular and gizzard junction where the two meet. That's a hallmark of Newcastle disease. And then, of course, we've seen here do you see the hemorrhage here in the small intestine? It is necrotic. The whole mucosa is just necrotic debris. So, as you go along, you'll see more hemorrhage. But I want to show you the hallmarks where it helps you for presumptive diagnosis of Newcastle disease. You've seen the hemorrhage in the cloaca. You see the hemorrhage at the proventricular gizzard junction. And you will see now at the cecal tonsils. We'll open the cecal tonsil. If we are lucky, we'll see also here some hemorrhage. But if not, I think we are pretty much satisfied so far.